Have you ever noticed someone suddenly having trouble speaking clearly? Perhaps their words sound muffled or hard to understand. This unexpected change in speech can be quite startling, and it often points to something serious happening in the body. When we talk about slurred speech in the context of the FAST test for stroke, it is a crucial indicator that someone may be experiencing a stroke. This symptom, often called dysarthria, means the muscles used for speech are weak or difficult to control, making words sound thick, slow, or garbled. It is a medical emergency requiring immediate attention. The reason slurred speech is such a significant warning sign for stroke lies in how our brain controls our ability to speak. Speech involves complex coordination of muscles in the face, tongue, throat, and diaphragm, all directed by specific areas in the brain. A stroke occurs when blood flow to a part of the brain is interrupted, either by a clot or a bleed. This lack of blood deprives brain cells of oxygen and nutrients, causing damage. If the stroke affects the brain regions responsible for language or motor control of speech muscles, slurred speech can rapidly develop. Recognizing slurred speech is a key part of the S in FAST, which stands for speech difficulty. If you notice this in someone, ask them to repeat a simple sentence, like, "The sky is blue today." Listen carefully for any slurring, unusual pronunciation, or difficulty forming words. It is not about whether their accent changes, but whether their usual way of speaking has suddenly become unclear or unintelligible. It is important to understand that slurred speech caused by a stroke is not simply due to fatigue or a minor illness. This kind of speech difficulty, or dysarthria, results from neurological impairment affecting the motor pathways that control articulation. Sometimes, a stroke can also cause aphasia, which is difficulty understanding or expressing language, and it can occur alongside dysarthria, making communication even more challenging. The abrupt onset of these symptoms is what makes them so indicative of a stroke. Ultimately, slurred speech in the FAST acronym is a direct signal from the brain that something is profoundly wrong. It is a clear call to action, indicating that brain tissue is at risk and every minute counts. Understanding this critical symptom empowers you to act quickly, ensuring the person receives the emergency medical care they need to potentially minimize damage and improve their recovery.